9682, you are more than a number, speaks to something that for long I've been very passionate about. And that is the fact that it is not just healthcare for all, but quality healthcare for all, irrespective of socioeconomic statuses. A renovated Katutura State Hospital emergency unit, in collaboration, of course, with Standard Bank and the MVA, allows us to treat people from all corners of Namibia with dignity. And then, of course, the number itself, 9682, standing for the fact that if you witness an MVA or if you are in an MVA, that is the number you should dial. And a lot of people did not know that. But now it is readily available, and we all know what to dial in cases of emergencies. I was sitting in the launch today and I was listening to the CEO of Standard Bank and his thoughts about the launch and its significance in the healthcare of Namibia. And for me, it was a beautiful moment because it showed me that there really is hope for the Namibian healthcare sector. And it was evidence that if we do stand together, as cliche as it sounds, but if we all stand together and play our role, we truly can see an improved healthcare sector. Unlike previously, where we would think that it is impossible to achieve standardized healthcare, this, what Standard Bank together with partners such as MBA have done today, is truly testament that it is possible to achieve better healthcare that offers a sense of dignity. And so it's a call to all corporates, governmental organizations, non-governmental organizations, as well as private entities to do some introspection and see how they can meet and join the party so that we can achieve compact change. In order to improve healthcare and accessibility for healthcare in Africa, the first thing we need to look at is, number one, accessibility, right? Because a lot of people within less advantaged areas are not able to access our hospitals. And we've seen it readily. We've seen it with mobile clinics. We've seen it with outreach. But now with the advancement of modern technology, we have taken it far further than just mobile clinics and outreach. Now we are coming up with technologies and artificial intelligence in healthcare that allows us to literally take the doctor to the patient, take the medication to the patient, and by so doing, take quality healthcare to the people. So technology is meeting us where we need it the most. It is important that we understand that when a patient comes to you and they're ill, they're sick, they are probably in their most vulnerable state. And so as a doctor, as a healthcare worker, as policymakers, leaders, be it government or organizations, it is our responsibility to ensure that when we treat patients, we offer them an environment that grants them a bit of dignity, even in their most vulnerable moments. And this project stands as the perfect example of how we can make sure that people from all corners of the world are afforded quality health care with dignity. And by doing so, we are then able to ensure that patients are not limited by their socioeconomic status, but that all patients are afforded standardized healthcare. I think as a medical doctor, my most profound experience was when I started working at Onanjokwe Hospital in the north of Namibia. And that for me was probably the experience in healthcare that I treasure the most. It showed me that, yes, there is still so much to be done in healthcare, but it showed me the courage of healthcare workers and that healthcare workers really are passionate about what they do. And so for me, that was, it brought me to an understanding that there is so much room for public health and so much room for public health specialists in order to advance the quality of healthcare within the African continent as a whole. And so my experience obviously showed me that there are some places where we can still improve, but it also showed me that with the right passion, commitment, dedication, as well as knowledge in terms of public health, we truly can impact the change that we want to see.